Hi everybody, today I am going to talk about the pain mechanism in frozen shoulder. Frozen shoulder is a condition in which the capsule of the shoulder joint will get inflamed with subsequent tightness and adhesion over the underlying bones, and the symptoms are pain and movement restriction. Most of the time my patients come to my clinic for the complaint of pain, not necessarily movement restriction. As a physio and as a frozen shoulder sufferer, one should know what are the probable mechanisms of pain in frozen shoulder. Since it is a capsule problem, since it's a primary inflammatory problem, inflammation of the capsule is called as capsulitis. So such inflammation will produce inflammatory pain, which is more so during the freezing state of frozen shoulder. So the capsulitis can cause pain, which is more during the rest time and sometimes during the night, and it will be in the first stage, otherwise called as the freezing stage of frozen shoulder. It is dull in nature, localized in the nature, it doesn't really go down, it's more of local regional pain. The next mechanism of pain is the mechanical pain. This will be happening more so during the second stage of the frozen shoulder, when the inflamed capsule will start to shrink and develop new blood vessels and more nerves around the capsule in order to protect it from getting stretched. So this is one of the adaptive mechanism of the capsule of the frozen shoulder, but that will be the major reason for the pain in frozen shoulder. When they attempt to do the movement, the capsule will get stretched. Not only that, the nerves will get stretched, the blood vessels will get stretched, that will produce a sharp shooting pain in the shoulder as well as to the arm. Okay, this we call it as movement induced pain, otherwise called as mechanical pain. Sometimes we call it as a jerk pain, because unknowingly they do something and then they will repent for it, and some patients will really cry out of this pain. Okay, so this will be sharp, but it is brief in nature, because after 2 minutes, 3 minutes, 4 minutes, the pain which is obtained during the movements will come down and it will come to the baseline. So this is called as mechanical pain, which will happen during the frozen as well as during some late stages of freezing state. The third type of pain is due to the cervical radiculitis. These are the people who will be having pre-existing neck pain or cervical spondylitis with or without radiating pain, which will join with the existing frozen shoulder. So now the pain is compounded. So these people will have constant throbbing, pulsating pain. We call it as a pulsating pain. So these patients will have sharp pulsating pain, and it will be there throughout the day, and these people will have difficulty in falling asleep. Some of my patients will be having sleepless nights for months together, and they will not require whatever treatment they take, because the underlying nerve issue has to be corrected, and this will occur more during the frozen or the thawing stage. The locality of the pain with the underlying cervical radiculitis is not only confined to the shoulder and the arm area, it can sometimes go down to the forearm and even to the wrist and the hand, and some people will have pain in the neck as well as the medial scapular region. So just by the locality of the pain, you can understand that the pain is not only from the frozen shoulder, it is having some cervical radicular component. So as a physio, you should treat the underlying neck component, so that whatever attempt you make to treat the frozen shoulder will be fruitful. If not, these patients will not recover. Alright, so these are the three ways by which we understand the mechanism of pain in frozen shoulder. The first one is capsulitis, pain coming from the inflamed capsule. The second one is the mechanical pain, pain occurring due to the stretched capsule during movements, and the third one is the cervical radicular pain. And this type of pain will not occur in all frozen shoulder. Maybe 2 in 10 or 3 in 10 of frozen shoulder will be having the cervical component. These are the people who will be having pain for a long period of time. Even in the thawing stage, these people will not enjoy the painlessness, and they wonder why the thawing stage is not getting over, because there is an ongoing nerve issue happening. So if someone understands the mechanism of the pain, it is easy to treat it, so that the patients will get pain relief as well as the movement can get better. I hope you liked our video.